17 years after HIV and AIDS was declared a national disaster in Kenya, several interventions have been employed to curb the disease, with major focus on prevention methods. Despite several interventions locally and globally, a report released by UNAIDS shows the rate of new infections remains high, especially among girls within Sub Saharan Africa. The statistics come as key stakeholders are set to converge for a two-day United Nations General Assembly high-level meeting in Geneva, with focus shifting to international donors to increase funding for HIV, fast-track mitigation efforts, adoption of resolutions attained at WTO conference, and reducing the cost of accessing ARVs if the HIV and AIDS endemic is to be arrested by 2030.
Particularly in Africa, we're failing young girls, adolescent girls. We have more than 5,000 new infections amongst young girls every week.
And our positions to the political declarations had to do with, one, investing in HIV prevention. The bottom line is we are in a place where the numbers of new infections are way higher than the number of AIDS-related deaths a year.
While launching the report, Health Cabinet Secretary Clopa Mailu regretted that despite collective efforts to combat HIV and AIDS, the country records 100,000 new infections annually.
Since the country still is battling with more than 100,000 new infections annually, this high number of new infections is unacceptable, meaning a lot more needs to be done.
Mailu also cited stigma as key impediment in rolling out treatment to key populations such as sex workers, drug users, transgender, prisoners and gays. Lynace Mwashigadi for Channel 1 News.